Hello, I'm Khalid Saab, and I'll be giving a quick overview of our paper titled Reducing Reliance on Spurious Features in Medical Image Classification with Spatial Specificity. Curating real-world medical datasets for healthcare ML is a messy process. For example, if we consider chest x-rays, we might have some images coming from different age groups, different areas of the hospital, for example, an emergency unit versus a monitoring unit, or different scanners. As a result, these datasets may be full of spurious correlations, where hidden attributes, such as patients with treatment devices, are strongly correlated with target illnesses. These spurious correlations are a big issue for healthcare ML, as is shown in a growing body of work, who have identified multiple pitfalls of ML systems as a result of these spurious correlations. In this spotlight talk, we're going to focus on the example of classifying the existence of a pneumothorax from a chest x-ray. When we train a CNN on this task, we're initially deceived by our model's performance, which exhibits expert-level classification strength. However, if we take a closer look into the model's errors, we recognize that the model performs at random when there are no chest tubes in the image, suggesting that the model has heavily relied on chest tubes, which are used for treating pneumothorax but should not be relied on for diagnosis. In this work, our goal is to reduce the reliance on such spurious correlations. To measure the reliance, we define the robust AUROC as the model's performance on the subset of images where the spurious correlation does not hold. Our approach is to intervene at the task level by increasing the spatial specificity of the task. For example, as we move from a binary label to a bounding box, and finally a segmentation, we're making our task more spatially specific. Our insight is that as we define our task more specifically, we weaken that spurious correlation. In our work, we start off by presenting an analysis to understand the impact of spatial specificity on spurious feature robustness. We found that as we increase spatial specificity, we decrease the variance of positively labeled inputs, resulting in more tightly clustered class embeddings. We also found that the mutual information between abnormal labels and spurious labels decreases. As previously reported, we see that a naive classifier has random performance on the subgroup without the spurious correlation. We also observe that models trained with robust optimization techniques that operate in the binary label setting still exhibit high reliance on the spurious feature. When we train a bounding box model, we observe much improved robustness performance, though there's still a gap. Finally, when we train a segmentation model, we see even larger gains for robust performance. However, as we increase the spatial specificity, we're also increasing the annotation cost. And as a starting point for this trade-off, we explored self and semi-supervised learning techniques, which we found to improve the labeling burden. We hope our quick overview got you excited to come find us and learn more at a poster session. Thank you.